Can Unclear PET scans lead to more colon cancer appointments? Imagine getting a scan that shows some suspicious activity but isn't quite clear enough to say for sure if it's cancer. That's what can happen with PET scans used in colon cancer diagnosis and management. PET scans, or positron emission tomography scans, are powerful tools because they show how active cells are in the body. Cancer cells tend to be more metabolically active, so they often light up on these scans. This makes PET scans especially useful for finding cancer spread or recurrence, helping doctors decide on the best treatment plan. However, PET scans are not perfect. Sometimes they produce unclear or indeterminate results. This can happen for several reasons. For example, inflammation or infections in the colon or nearby tissues can cause increased metabolic activity, which might look like cancer on the scan. This can lead to false positives, meaning the scan suggests cancer when there isn't any. On the other hand, small tumors or certain types of colon cancer, like mucinous adenocarcinomas, might not absorb enough of the radioactive tracer used in the scan, leading to false negatives. This means the scan might miss some cancerous areas. When a PET scan result is unclear, doctors usually don't jump to conclusions. Instead, they often recommend additional tests to clarify what's going on. This might include repeating the scan after some time, doing a biopsy, or scheduling a colonoscopy. These extra steps help ensure that any suspicious findings are correctly identified and staged. Accurate staging is crucial because it influences treatment choices, such as surgery, chemotherapy, or targeted therapies. Having an unclear PET scan doesn't mean there is definitely more cancer. It simply means that more information is needed. These additional appointments and tests are part of a careful process to avoid missing a treatable recurrence or metastasis. They also help prevent unnecessary treatments for false alarms. The goal is always to get the most accurate picture of the patient's health so that the best care can be provided. In summary, while PET scans are highly valuable in managing colon cancer, unclear results can lead to more follow-up visits and tests. This is a normal part of the diagnostic process, aimed at making sure nothing is overlooked. If you or someone you know is going through this, it's important to discuss all concerns with healthcare providers. They can explain what the results mean in the context of your overall health and guide you through the next steps. Remember, each case is unique, and personalized medical advice is always the best course of action.